Hello and welcome to Health Matters on Channels Television. Thanks for joining us. I am Mary Alale Yusuf. Each year, according to the World Health Organization, hundreds of millions of patients around the world are affected by what is called healthcare-associated infections. Although HAIs, as they are called for short, are the most frequent adverse event in healthcare, the global burden remains unknown due to difficulty in collating data. However, scientific evidence shows that good hand hygiene practice is the single most effective action to stop the spread of the infection, in combination, of course, with other important measures. According to the Apex Health Body, good hand hygiene prevents up to 50% of avoidable infections in healthcare and can even stop outbreaks of infection. My guest joining us from our Abuja studio is Program Coordinator for Antimicrobial Resistance and Infection Prevention and Control at the NCDC, Dr. Tochi Okwo. You're welcome to the show.
Thank you, Mary. Thanks for having me.
Now, there's a hand washing day, I discovered, and there's a hand hygiene day. Let's clear this up first. Is this a duplication, or is there more to hand hygiene than hand washing?
Yes, it's not a duplication, but I think the most important thing to take away from that is that, indeed, making the hands clean is very important. So imagine if there are 2 days that are dedicated to making the hands clean. But the hand hygiene day you mentioned earlier is the one where everybody, hand hygiene in community, hand washing in community, hand washing in every setting to avoid infectious diseases. But then the 5th of May is singled out for emphasizing the value and utility of hand hygiene, that is making the hands safe in the provision of healthcare. So the emphasis for this May 5th Hand Hygiene Day activity is on places, the health facilities where we provide health care. So it focuses on patient safety, it focuses on keeping health workers safe. And then to the point, the question you asked about, is hand hygiene different from hand washing? Hand hygiene is more of a general term used in describing the ways we make our hands safe using either hand washing or using an alcohol hand rub.
Okay. We've heard of 5 WHO hand movements. Can you tell us those 5 moments and if they've been added on to since they were announced?
Thank you, Mary. There are many moments when we are in healthcare, or indeed any time we are in the hospital environment, where we must do hand hygiene, wash our hands with soap and water or with alcohol hand rub. But you know, as you mentioned earlier, the main problem is what we call healthcare-associated infections. That is, those infections that people get when they come to hospitals that they didn't have incubating or in them before they came to access healthcare. So what WHO has done is that they have looked and using evidence and applying clear, rigorous research, it has been found that there are 5 critical moments during which a health worker must render the hands safe for the administration of healthcare. So these are those 5 moments that a health worker must apply hand hygiene as he offers care. And those moments are: 1, before a health worker touches a patient, the health worker must make the hands safe using hand hygiene. Before a health worker carries out what we call a clean or an aseptic procedure, the health worker must make the hands safe by doing hand hygiene. Then when a health worker's hand has been exposed to body fluid, what we call body fluids, following that exposure, the health worker must make the hands safe using hand hygiene. And then after a health worker has touched a patient, that is another moment that the health worker would also need to make the hands safe using hand hygiene. And anytime a health worker has finished with a patient and is leaving after contact with what we call patient surrounding, the health worker also needs to apply hand hygiene. So these are the 5 moments that are known, that evidence has shown that it prevents the transmission of organisms that cause infection from one person to the other. That is why WHO has singled out those 5 moments as those critical moments that a health worker must apply hand hygiene. And then this is where it connects with the methods. Within those 5 moments, a health worker also needs to make a choice, make a decision. Should I use an alcohol hand rub at this moment, or should I use soap and water? So there are also indications for when a health worker would make the hands safe, do hand hygiene, utilizing an alcohol hand rub, or utilize soap and water. And we say that it is better for most of those moments for an alcohol hand rub to be used, but if a health worker's hand is then soiled with body fluid, which contains a lot of protein, with body fluid, in those moments of soilage, what is now recommended is that a health worker now uses soap and water. So that's where the moments connect with the methods available to the health worker.
Okay, so however, hand hygiene is supposed to be a universal thing, not just for health workers. How do you describe the moments for a regular person?
Well, the moments, like I said, are moments where you see that a health worker connects with a patient, connects with a patient in a patient environment.
Just a moment,
the
doctor.
5 moments are specific.
What I mean
to
is
administration of healthcare.
For a regular person, what should that person observe as hand hygiene moments? Since we are not doctors, we're just regular people, when should we wash our hands or clean our hands? That's what I mean.
Okay, thank you for clarifying. So for a regular health worker, for a regular person who is not a health worker, it is no longer those 5 moments. The moments become much more than 5 because they become moments that you need to make your hands clean for whatever reason. So for instance, before anybody eats, we need to wash our hands with soap and water because we do not want to introduce disease-causing organisms into our system through our mouth. When we utilize the restroom or anytime we think our hands have been soiled with any form of fecal matter or any form of dirty substance, then we need to wash our hands. Anytime we go out and come back to our homes, we need to wash our hands. So there are many moments that in the community, as individuals, in the family, in schools, that we need to wash our hands and make our hands safe using soap and water or alcohol-based hand rub. But the 5 moments specifically apply in the administration of healthcare.
Okay, for this year's theme, it contains a phrase. They talk about unite to keep your hands safe and all that, but they talk about a safety, climate, and culture. What does that mean?
Well, an individual can make up his or her mind as a health worker to ensure that she does hand hygiene at the right moment. But it's been found that motivation, passion alone is not enough to drive that. There needs to be this whole institutional climate of safety. Doing things in a safe way, having that safety of culture has been shown to be the sustainable way. And what does that mean? It then means that everybody must band together. All the stakeholders must come together to ensure that the systems are in place and it becomes an easy option, an easy choice for a health worker to do hand hygiene. So, from training health workers so that they at least have the knowledge. That is one of those things. And then you need to make the infrastructure available. You need to make the materials for hand hygiene available. Alcohol hand drops need to be available at the points of care. Sinks with soap and water have to be available at the right places with running water provided. And then you can see that unless you have an institutional safety culture, all these cannot come together in the right way. Aside that, you also need to sell this idea constantly to health workers, and that is where what we call the multimodal improvement strategies come together to make sure that we have this safety culture. What does that mean? You have provided the infrastructure, you have trained the health workers. It's not enough, it's still within a safety culture of quality improvement that all this operates. And therefore, we need to continue to monitor to see if health workers are indeed carrying out hand hygiene in those moments. Are they using the right products at the right time? And are they following the techniques for this hand hygiene? And having monitored that, a health worker still within that culture of quality improvement will need to get feedback so that both the health worker and the entire institution will know how well they are doing, and using that feedback, know how much more improvement that is required. That is still not enough. We need to have people in senior position, facility leaders, begin to champion this. It is obvious that if you see somebody senior, somebody you look up to, do something consistently, the natural thing is that the people who are in that team, the people who are led, will naturally pick those things up. And I'll give an example. In medical school training, there are so many times we are under consultants. We follow them around for ward rounds. Imagine where in an environment where hand hygiene has been properly internalized because such an organization, such a health facility has a strong safety climate, and a consultant who is leading a team adheres to hand hygiene, consistently following the right moments, using the right techniques. It is only natural that those people under training will just naturally pick it up. And it becomes a culture that is handed down from one generation of medical students and medical doctors to the next. So it is just everybody coming together to making hand hygiene the very, very easy option and pulling everybody together in that culture of safety. So that's part of what this year's theme is trying to emphasize.
In other words, a way of life. But there's something else that was said about hand hygiene. We understand that when you wash your hands, you keep your hands clean, then you don't tend to transfer so many diseases to other people. But how does that connect to reducing antimicrobial resistance? Because that's a big issue now in medicine, antimicrobial resistance. How does that happen?
Thank you for asking that question, Mary, because in fact, antimicrobial resistance has even made hand hygiene a lot more important. And what do we mean by antimicrobial resistance? Simply put, it's just saying that diseases that antibiotics used to take care of are becoming very difficult for antibiotics to take care of them because they are now resistant to the antibiotics. And on top of that is that if you look at the pipeline for the production of antibiotics, we don't have so many candidate antibiotics that are coming to the market, in spite of the fact that antibiotics are now failing. So we must fall back on at least prevention. So one of the ways hand hygiene helps in this fight against antimicrobial resistance is that for every infection you prevent, it is one more infection you don't have to treat, as basic and as simple as that is. We also have irrefutable evidence that hand hygiene, whether it is alcohol hand rub in the right conditions or using soap and water in the right conditions, helps in doing what we call breaking the chain of transmission, including in the transmission of infections that are caused by drug-resistant organisms. So in every way we look at it, even in hand washing in the community, children pick up things and put in their mouth and they develop diarrheal diseases. Exposure in the community can also lead to respiratory tract infections. All these will warrant the use of antibiotics, which when improperly used and depending also on the organisms that is causing the infection could already be resistant. But simple things like hand hygiene can break that chain. So hand hygiene has become very critical as we begin to live with the consequences and dealing with the consequences of antimicrobial resistance.
Okay, that makes a lot of sense. We're going on a short break now. Stay with us, everyone. Thank you so much, Dr. Oko, as you stay with us. We'll be back after now. Welcome back. We're talking about hand hygiene on Health Matters on Channels Television. Thanks for staying with us. And our guest is Dr. Tochi Oko. You can email using moalale@channelstv.com. You could also tweet at CTV_Mary A if you have questions on the topic. Thanks for staying in there, Dr. Okwo. You've been speaking about washing hands, you know, so much today. Can you tell us how we can wash hands? Because I see some people just rub a bit of soap and rinse it off. No actions with their hands, and they say they've washed their hands. What's the method?
Thank you, Mary. I'll attempt to show you the methods, but first of all, I'll say that for healthcare, for health workers, that's something very important. For hand hygiene to be what it should be and for it to be sustained, it has to take place within the context of what we call a functional infection prevention and control program, meaning that in every hospital, in every healthcare facility where healthcare is being provided, there should be a dynamic team that is in charge of infection prevention and control, particularly hand wash. And it is the duty of this team to ensure that every health worker gets the appropriate training on how to do hand hygiene that is relevant for the cadre of the health workers. I want to make that very clear. And then it is still within that context and the function of the team to make sure that health workers are supported to adhere to these hand hygiene practices. And it's still this team that would provide the feedback and any retraining that is required in health facilities. I want to make that very clear. But then, for hand washing, there are things that are important. Number one, we say the duration, that's the technique and then the duration. These are two important things that we must bear in mind as we do hand hygiene, whether we are using alcohol hand rub or we are using soap and water. Then let's start with soap and water. In healthcare, when we want to make our hands safe using soap and water, three things are required. You must have a source of clean running water. Emphasis on clean running water, meaning water that comes out and doesn't get back to recontaminate your hands. And it has to be clean. The second one is soap that you need to use to do the hand washing. And then a disposable towel, a disposable tissue for drying the hands. So these are the three materials that we must have all the time when we need to do hand washing in healthcare. The second one is that for you to do effective hand washing, it must last for between 40 to 60 seconds. So that's when we train it, these are the things we emphasize. So you start to wash your hands. First of all, you turn on the tap. And then you wet the hands. Make sure that all the surfaces of the hands are wet, first of all, with water. Then you apply the appropriate amount of the soap on your palms. And you know, we all have different sizes of palms. So you must apply the amount of soap you know that will cover all the surfaces of your hands and lather adequately when you're doing this hand wash. Having done that, you then put the palm of your hand on top of the other. The first thing you want to do is to generate lather. And the friction, the rubbing of the hands is also very useful in washing with soap and water, because that rubbing of the hands also helps to dislodge these microorganisms that are lying on our hands. So we rub up that lather vigorously, one hand on top of the other. Then you turn it and place the other hand on top of the other one. And then you rub on top of one on top of the other, the back of the hands. Then you place again one back of the hand on the other. You do that, you rub on it. Then you intertwine the hands and do up and down movement to scrape off the in between the fingers, because these are the commonly missed areas when we just do hand hygiene without following these steps. So this up and down scraping helps to remove the microorganisms that are in these in between our fingers. Having done that, you then clasp the hands to wash like this, to wash both the knuckles of the hands. You turn over, you repeat the same thing. Then you remember that while we've been doing all this, we have missed our thumbs. Then we go and we wash the thumb area thoroughly. We wash the thumb area thoroughly. You wash the thumb area thoroughly. Okay, and then having done that, we also wash the tip of the fingers, and then thoroughly rinse off under running water. After rinsing off, we get a disposable towel, a non-reusable towel for drying the hands. Then you pat dry thoroughly and make sure that there are no wet areas remaining, and then we'll safely dispose of the tissue or disposable towel that we have used in drying. And if you get this right, it should take at least between 40 to 60 seconds to get it done right. While for alcohol hand rub, it's basically the same steps. The only difference is that because the alcohol hand rub acts by drying and killing the microorganisms on the hand, we do not need to do it for up to the 40 to 60 seconds. So if we are using alcohol hand rub, it has to be between 20 to 30 seconds. So same thing, we all know our hands. Over time, we'll get to appreciate the volume of alcohol hand rub that will cover all the surfaces of our palms. So the thing is to apply the amount of alcohol hand rub, at least up to 5 ml or more, depending on what will cover the surfaces of your hands. Apply it, and then following those same steps we followed in using soap and water. We do that, but you find out that as you're doing that, the alcohol will dry up completely. And once you're able to follow those techniques, using the right volume and the right product of alcohol hand rub, the hands should be safe under those circumstances where an alcohol hand rub is indicated. So those are the steps and the duration, Mary.
A couple of problems arise. Well, apart from the fact that, let's just clarify, for health workers it's 40 to 60 seconds, but for normal everyday people, they say 20 seconds. Is that right? So number two.
Yes, it's said, but the most important thing, Mary, is that for ordinary people, not ordinary, for when it's not the setting of healthcare, often you find that most people will be using soap and water to make the hands clean and safe. It will be to follow those steps. Often we tell people, sing a happy birthday song in your mind. Once you've done that and the whole hands are thoroughly covered and washed, that should suffice.
All right. Then the second and last thing is, here in Nigeria, people are very concerned about leaving the tap running. So there's always this touching of the knob to close the tap. Is that okay, or should we just keep the tap running? That's one. And then, you know, disposable, how to close the tap if you keep it running. You don't want to touch that knob again, or is it okay to touch that knob?
Thank you, Mary. And this question you've asked re-emphasizes the point I've made earlier, that this whole hand washing, the training and the decisions health workers need to take in hand washing has to take place within a context and everybody working together as a team and guided by the infection prevention and control team. So under such circumstances, during the training, the peculiarities of the facility will need to be taken into consideration. So you see, you may then decide that because water is a problem and we have minimal source of water which we do not want to waste running, at least in fixing the taps, the knobs of the tap, can it be something that is maybe you can open or close with your elbows so that a health worker can open and close with the, can turn on and turn off with the elbows. Absolutely. And conserving water. That's one way. The second way is maybe you can use a disposable towel to turn it off if you have such resources to turn it off and dispose when you're done. So I can't sit here. I'll be very uncomfortable to sit here and tell people what to do in their individual situations, but it is to work it out. It's about preventing the transmission of infection, and adequately trained infection prevention control professionals who are supporting their colleagues within the context of a well-established infection prevention and control program will know how to work out these little difficulties, bearing in mind that it's about risk reduction and understanding how to break the chain of infection, even in the context of turning and turning off taps.
Thank you so much, Dr. Tochi Okwo. I'm sure some of those questions were a bit difficult to answer, given the setting that we are in, but thank you so much for coming and answering those questions. We've had a wonderful time. Thank you also, those viewers at home, every one of you. Have a lovely day. I am Mary Alaleyi.